Avoid these 5 health examinations after the age of 70. That might do more harm than good. The majority of seniors will never hear from their doctors, which is a secret. Millions of seniors wait in line each year for health examinations in the hopes of remaining safe. However, what if I told you that some of those tests, the standard ones your doctor recommends, may actually make you more susceptible to cancer, stroke, or surgery? According to recent studies, up to 37% of senior medical tests result in problems, needless treatments, or long-lasting side effects. Remarkably, 99% of adults over 70 are unaware that they are being overtested. As the top item on our list, one of these examinations is really responsible for 5% of all cancer cases in the United States, which is equivalent to the amount of instances brought on by daily alcohol consumption. Your clinic won't tell you this. It won't be displayed on a billboard. However, the science conceals the reality, which we are now revealing. The 5 health examinations you should avoid after the age of 70 are discussed in this video, along with the horrifying consequences they may have on your body. You won't believe how it came in at number 2, and it's all supported by actual science. Before we get started, please share your age, where you're watching from, and whether you've ever regretted a test or operation in the comments section below. Do you believe that seniors receive too many tests? We are reviewing each and every feedback and providing tailored guidance and recommendations. For more videos like this, remember to subscribe to our channel and like this one. Without further ado, let's discuss the initial test, why it could subtly degrade your quality of life despite appearing innocuous. The bone density scan is number 5. It sounds innocuous. After a brief scan that involves no discomfort or needles, you can determine your fracture risk and leave. However, nobody tells you this. A bone density scan can frequently cause more anxiety than benefit after the age of 70. Your bone strength is measured by this scan, which is technically known as a DEXA scan. It is mostly used to identify osteoporosis. Although even in cases where there is no actual risk, the results nearly invariably show reduced density in older persons, particularly women. This is due to the fact that bone loss is a normal aspect of aging. Everyone gets it, just like wrinkles or gray hair. However, many elderly people are forced to take drugs like bisphosphonates, which are meant to strengthen bones but have dangerous side effects like esophageal irritation and jaw necrosis, a rare condition in which the jawbone begins to die. Here's the issue now. Medication for modest bone loss in adults over 70 has little to no effect on fracture rates, according to studies. After 5 years, bisphosphonates only decreased fracture risk by 0.3%, according to a research that tracked 1,200 women over 70 and was published in the Journal of the American Geriatric Society. While not insignificant, it is by no means life-saving. Rather, those ladies were much more likely to experience adverse drug reactions, such as gastrointestinal problems, esophageal inflammation, and brittle bones that break in strange ways. Let me tell you about Rose, a retired piano teacher who is 76 years old. Following her yearly physical, she was recommended to have a DEXA scan. She walked every day, had no pain, and had never fallen. Osteopenia, a slight decrease in bone density that is not regarded as osteoporosis, was revealed by her scan. Her doctor began her on alendronate, a bisphosphonate, right away. She experienced excruciating reflux and jaw pain after 3 months. She had not played the piano for weeks by the time we saw her. We stopped her medication and began a vitamin D regimen, weight-bearing activities like resistance bands, and a diet high in calcium, including leafy greens and sardines. After a year, she returned to giving recitals with improved balance, stronger legs, and no fractures. A quick scan might seem like a good idea, but lifestyle is a better alternative for persons over 70 who aren't breaking bones or falling. A 2022 osteoporosis international study found that correct nutrition, strength training, balance exercises, and vitamin D deficient treatment can minimize fractures by more than 20%. Avoid being scared into receiving treatment you might not need by a number on a screen. However, one scan has the potential to result in brain surgery, which is even more terrifying. Next, let's discuss it. Brain MRI for memory loss comes in at number 4. The natural reaction in elderly people who are more forgetful or confused is fear. Fear of Alzheimer's disease and dementia. In response, physicians frequently request a brain MRI. Here's the unsettling reality, though. Patients rarely get the answers they want from MRIs, which are precise images that reveal the structure of the brain. Actually, the majority of MRIs performed on adults over 70 only reveal age-related alterations, such as white matter spots or mild shrinkage, which are completely typical in this age group. Here's the worst part, though. When those spots are discovered, they may lead to additional testing, surgery, and a wave of anxiety. Surgery that can worsen memory problems rather than help them. A study that was published in Neurology Today in 2021 examined more than 3,000 MRI images of patients with mild cognitive symptoms who were between the ages of 70 and 85. Only 3% of the findings were connected to a real, curable illness, despite 86% exhibiting some kind of brain abnormalities. This indicates that 97% of participants experienced the psychological toll of learning that something was amiss when in fact it wasn't. Even worse, based on ambiguous scan results, almost 12% were referred for invasive treatments such as exploratory biopsies or spinal taps. Consider George, a retired engineer who was concerned about forgetfulness and was 74 years old. Despite his brilliant mind, he frequently misplaced his keys and occasionally forgot names. An MRI that revealed white matter alterations was ordered by his physician. Believing he had dementia, he panicked. He stopped attending church and driving. His worry grew during the ensuing months. However, he scored well inside the normal range on a routine cognitive test when we examined him. We clarified that the MRI results were consistent with the patient's age. We assisted him in concentrating on lifestyle modifications such as brain games, sleep, and water. After 3 months, he felt like himself again and his memory had stabilized. In actuality, an MRI is rarely beneficial for minor memory loss unless there are serious neurological symptoms such as seizures, abrupt personality changes, or rapid functional decline. A cognitive screening test, a straightforward paper-based assessment that gauges memory, attention, and problem-solving skills, is a better place to start. It is inexpensive, efficient, and prevents needless panic. Now, get ready, because the next test on our list is likely one you've taken more than once, and it's ranked number 3 for a reason. The third is the heart stress test. Seniors who complain of chest tightness, minor weariness, or are simply not feeling as good as they used to are frequently offered this test. The purpose of the cardiac stress test is to identify clogged arteries by monitoring your heart while you walk on a treadmill or take medication that mimics activity. However, after the age of 70, this test frequently causes more harm than good, particularly when administered to individuals who do not exhibit any obvious symptoms of cardiac disease. This is due to the fact that it may result in erroneous alerts and needless, dangerous cardiac treatments. The accuracy is the issue. According to studies, the false positive rate for stress tests in persons over 70 can reach 40%, which means the test indicates a problem when none exists. This results in needless stent installation or bypass surgery, as well as follow-up testing like angiograms. More than half of all stents inserted following stress test recommendations were performed on patients who had no apparent symptoms or benefit, and those patients did not see an improvement in survival or quality of life following the treatment, according to a significant 2017 study published in JAMA Cardiology. However, they did experience longer hospital stays, increased rates of bleeding, and kidney damage from contrast dyes. Raymond, a 75-year-old retired postman who kept active by going for daily walks, experienced this. He noted that he occasionally felt exhausted on hills during a checkup. To be sure, his doctor ordered a stress test. He was referred for a catheterization, a procedure that involves inserting a tube into the arteries to check for blockages, because the results were not entirely clear. A stent was inserted after a minor constriction was discovered. However, Raymond experienced kidney issues as a result of the contrast dye reaction that evening. He required follow-up care for weeks after spending 6 days in the hospital. Since it wasn't a cardiac issue in the first place, the lethargy persisted. He was just an elderly man in need of more rest in between meals and greater hydration. A stress test could be more detrimental than beneficial if you are over 70 and do not have the typical cardiac symptoms, such as chest pain when exerting yourself, shortness of breath when exerting yourself, or a noticeable decrease in energy when performing little exercise. A coronary calcium scan, a low-radiation imaging test that determines whether hazardous plaque is accumulating, or even a resting electrocardiogram, which examines the heart's rhythm while you're motionless, are frequently better options. These are much less likely to force you to have a surgery you don't need, and they are safer and easier. The second is a colonoscopy. This one undoubtedly caught you off guard. However, unless there are certain symptoms, a colonoscopy, a treatment that examines your colon with a long camera, is rarely advised after the age of 75 and is not necessarily a smart decision after the age of 70. As one ages, the risks increase. Strong laxatives used in the tough preparation can result in kidney problems, dizziness, and dehydration. In older persons, the anesthesia utilized during the treatment presents additional hazards to brain function. Most unexpectedly, the test itself may result in side effects like ripping, bleeding, or even irregular heartbeats when under sedation. JAMA Internal Medicine published a 2019 study that tracked more than 1.3 million Medicare beneficiaries who were 70 years of age or older. They discovered that only 2 lives were saved for every 1,000 colonoscopies performed on individuals older than 75, but more than 20 persons suffered from severe side effects. The risk-to-benefit ratio is 10 to 1. Furthermore, many polyps are tiny and grow slowly, even when they are discovered. In some cases, removing them from an elderly person can be more detrimental than leaving them alone. Dana, a 73-year-old grandmother, and her daughter operated a modest bakery. She had no family history of colon cancer, no symptoms, no bleeding, and no abnormalities in her stool. However, her recently graduated primary care physician advised her to have a screening colonoscopy. She concurred. She was sent home after a procedure in which a tiny polyp was removed. She fainted that night due to severe abdominal pain. They discovered a bowel perforation in the hospital. She lost 10 pounds during her 9 days in recovery, and she hasn't been the same since. Upon reviewing her case, we discovered that she had previously undergone 2 successful colonoscopies. There was no need to do it again. Most adults should stop routine colon cancer screening at age 75, according to the U.S. Preventive Services Task Force. A stool-based test, such as the FIT test, a non-invasive fecal test performed at home, is frequently a safer choice for people in good health. It detects the majority of alarming instances without any preparation or anesthesia. It's difficult to get out of the colonoscopy pipeline once you're in it, so ask your doctor about your options. We've arrived at the most common, hazardous, and damaging examination for seniors, and it's quite likely that you've had it done. Annual full-body CT scans are the first. Full-body CT scans are promoted as a means of detecting cancer early, and are occasionally provided as preventive services in private clinics or as part of executive health packages. Here's the startling reality, though. Your body is exposed to a significant amount of ionizing radiation during these exams. The risk of causing needless follow-ups, biopsies, and even surgeries is extremely significant for older persons, particularly those over 70. Ironically, there is no proof that full-body scans that don't cause any symptoms can save lives. 10 to 20 millisieverts of radiation, or roughly 500 chest X-rays, are delivered with each scan. A 2023 modeling analysis that was published in JAMA Internal Medicine suggests that the increase of CT scans in the U.S. may now be accountable for as much as 5% of all malignancies, making them comparable to alcohol as a cause of cancer. This implies that a scan that was intended to prevent disease could be the cause of 1 out of every 20 malignancies. That is not just ineffective, but also frightening. Innocent nodules, calcifications, or cysts that are merely a result of aging can be found by the scan. However, a red flag is raised as soon as they are spotted. There are more scans, biopsies, and then anxiety. Allow me to introduce you to Marcus, an active 80-year-old who once instructed younger elders in martial arts. He participated in a senior elite checkup at a private facility and felt fantastic. A little 3-millimeter lump was discovered during his full-body scan. That triggered a series of events. He was sent for a PET scan, referred to oncology, and ultimately had a needle biopsy. The outcome? Harmless. However, a portion of his lung collapsed during the biopsy, necessitating hospitalization and a 2-month recuperation period for anything that might have been ignored. Experts now recommend against using full-body CT scans for general screening in adults who are asymptomatic. It is evident from the American College of Radiology. There is a considerable risk of injury and no shown benefit. Targeted imaging makes sense if there are symptoms such as noticeable swelling, blood in the cough, or unexplained weight loss. Without focus, however, scanning the entire body is like using a landmine detector to find gold. Even though you could discover something, the harm might be worse than what you were attempting to prevent. Paying attention to your body is a safer and more intelligent strategy. Maintain routine checkups with your primary care physician and only perform tests that are clearly suggested if you feel well. Your health, time, and energy are too valuable to be wasted on screening, based on fear that might make you worse off than before. That's it. 5 examinations that, although they can seem beneficial, might be harmful, particularly after the age of 70. Despite its strength, modern medicine is not flawless. Less is more in some situations. Never stop asking yourself, what if this test finds something? It could be necessary to take a break if the solution is not clear or if the hazards outweigh the benefits. And keep in mind that lifestyle is where true prevention begins. Be active, eat healthily, get enough sleep, and pick your checks carefully. We'd like to hear from you now. Have you or a loved one ever experienced problems as a result of an unwarranted medical test or treatment? What took place? Please leave your thoughts and experiences in the comments section below. We enjoy listening to them. Thank you for viewing.